Welcome to Interactive Imaging TV. I'm Scott Drake with my guest in studio, Dr. Dale Miles. And today we're talking about technology to help reduce radiation during dental x-rays. Dr. Miles, welcome back. Should patients actually be worried about the amount of radiation that they're getting during an x-ray?
Good question, Scott. And that question, I mean, dentists get asked that, or their staff members, every week in the dental office. And we always, as a profession, are concerned about limiting x-ray dose to the patient. We've taken a lot of measures to do that. Faster receptors, thyroid collars on children, leaded aprons if the dentist is still using a receptor like film. But most dentists are now transitioning to digital x-ray imaging, and depending on the system, you're getting up to 90% reduction of dose for each film or each image taken just by going to digital. There also are products in the marketplace that have been presented to the dentist, to the dental profession, to move towards rectangular collimation from the large round cone that's often used in the dental offices. So the dose is very low. We always worry about it. The concept is called as low as reasonably achievable. And all the measures that dentists take in their office are to reduce the dose to both the patient and, children of patients especially.
And again, with the dose reduction in mind, what's some of the new technology out there?
Well, the technology actually isn't all that new, but the form factor, the way we're presenting it now to the dental profession has changed quite a bit. We taught long rectangular collimation for years as a secondary type of collimation, but it's very difficult for the assistant or the auxiliary to actually aim and hit the target. So most people abandon it. They get it taught in their school programs and they switch back to round cone because it's a larger area. But the National Council on Radiation Protection, along with the FDA and the ADA, have produced guidelines that will become maybe more than guidelines in 18 to 24 months. And these actually say to the dentist that you need to be using rectangular collimation. So I actually brought a couple products. One product I've shown you before, we've seen pictures of, but I have it live now. We have a device called the Tru-Align. And this is a retrofittable device that goes on any x-ray tube. The rings that doctors use and dental assistants use to capture the images, we've made into a rectangle. And you'll notice the little shiny things are actually magnets. So once the rod is put in place and that's placed in the patient's mouth, if they're sitting there with this in their mouth, then the unit is brought up. It makes a magnetic contact, lights come on to show that now the patient and the x-ray tube are physically linked. So you can't miss. And you've been in a dental office, I'm sure, where they've said we have to do a retake. This virtually eliminates retakes. Once the patient procedure is done, you slowly bring the tube out again and then the ring out of the mouth with the receptor. So that was the Tru-Align. We introduced that in 2011, and it's become quite popular. But we haven't sat on our laurels. We've actually moved ahead with a new product. We've got a much smaller unit. We call it the Tru-Image. You can see the difference in the size. And this one kind of looks like Apple designed it, I think. I was very pleased with the design team. Same sort of format. We have a positioning ring here. Again, it has the rectangular collimation materials on it to reduce the dose. The dose with rectangular is 5-fold reduction in x-ray dose to the patient. Especially interested in getting the dose low for children. So again, using the rods, and I'll provide you with some pictures of those. We place the rod with the ring in the patient's mouth. Then basically we bring up the unit and the light comes on again. You can see the lights here to show that it's engaged. And the same concept, smaller unit, retrofittable onto every dental x-ray machine. What I like about this one is that there are different size machines, of course, cones that are round. They're big big and round. This is a compressible foam rubber that when we put it on, we lock it in place. It fits any unit out there in the marketplace. So we're making great strides in a simple device to reduce patient dose.
My guest is Dr. Dale Miles, and this is Interactive Imaging TV. Thanks for watching.